The topic for our presentation is irritable bowel syndrome, which is also known as IBS. What is IBS? Irritable bowel syndrome is a chronic disorder of the gastrointestinal tract characterized by abdominal pain and alterations in bowel habits in absence of detectable structural or biochemical abnormalities. People suffering from IBS not only experience gastrointestinal distress, but also suffer from psychological disorders like depression and anxiety. Psychosocial factors are believed to influence GI sensory motor function and or symptom generation in functional GI disorder as predisposing, precipitating, or perpetuating factors. Comorbidities with psychiatric disorders, mostly mood or anxiety disorders, are frequent. Patients with IBS have a poor quality of life due to frequent hospitalization, doctor visits, absence at work, and lower productivity. In short, they utilize the healthcare system more than patients without diagnosis. IBS affects around 9 to 23% of the population globally, mainly in Europe, South Asia, and North America. In Canada, 3.7% of men and 7.85% of women within 18 to 34 years experience IBS. Most of the time, individuals with symptoms of IBS do not seek medical attention. Women are reported to have higher prevalence of IBS symptoms as compared to men, but in places like South Asia, South America, and Africa, the opposite is observed, where the rate of IBS in men is higher or closer than to women. IBS is observed in all age groups, but first symptoms are usually reported before 35 years of age. It is also reported that the symptoms are milder for patients above 50 years. Mechanism of IBS. IBS symptoms have unclear etiology, and there is no specific treatment available to treat IBS patients. Recent studies show that the symptoms of IBS mostly are likely to occur due to gut-brain axis imbalance, as evidenced by increased abdominal pain during periods of stress. Stress can cause changes in intestinal motility and permeability, along with microbiota imbalance, as some cases developed IBS due to alterations of the gut microbiota as a result of infection. The treatments, which include dietary interventions, are used like in establish regular meal patterns, which would include breakfast, lunch, and dinner, with a few snacks in between. Avoid skipping or leaving long gaps between meals. Avoid large meals and consume food slowly while sitting down and chewing thoroughly. Alcohol should be consumed within safe limits and no more than 1 drink per day for women and 2 for men per day. Caffeine should be limited to 400 mg. It is found that digestion of spicy foods trigger IBS symptoms, therefore foods should be restricted or limited. Consumption of soluble fibers help decrease IBS symptoms. Individuals who reduced the consumption of lactose benefited their IBS symptoms. Low food map diets can also be recommended, but these diets are not to be followed long term and are provided by healthcare professionals only.
Treatment, exercise, and lifestyle. Modulating diet and more recently exercise and sleep have been some of the therapeutic tools used for treating IBS. A low fat diet is often recommended as fatty foods may cause painful contractions in patients with irritable bowel syndrome. Increased exercising has shown to improve IBS symptoms. A 20 to 60 minutes of physical activity, moderate to vigorous exertion performed 3 times a week for a minimum of 12 weeks showed a significant improvement in the symptoms of IBS compared to patients with random care. Pharmacological interventions. The American Gastroenterological Association highly recommends the use of linaclotide over no drug treatment in patients with irritable bowel syndrome constipation. Probiotics is considered as one of the treatment options. One of the potential treatment options for IBS are probiotics. Lacey states that probiotics potentially benefit through a modification of gut bacterial microbiome, which may improve mucosal immunity and restore the gut barrier function. However, some studies have shown that probiotics may aggravate the symptoms, especially bloating. Bifidobacteria infantis is the best studied probiotic so far. In a placebo controlled group, it improved abdominal symptoms of bloating and bowel function. Current data provides limited evidence for the efficacy of a small number of single strain probiotics in IBS, mostly bifidobacteria. There is a limited amount of quality evidence for the empiric use of probiotics in IBS. The randomized controlled trials that have been performed are typically small and are limited by publication bias. Previous trials have typically included strains of Lactobacillus species, Bifidobacterium species, and Propionibacterium species. More research is required to draw conclusion on the dose and the efficacy of the probiotics for IBS. Another treatment is in small groups of IBS patients. Curcumin at 72 milligrams or 144 milligrams have shown to, for given for 8 weeks, has decreased abdominal pain intensity and improved the quality of life. Anatole is a major component of fennel oil seeds. In a pilot study on IBS patients, the fennel reduced cramps, abdominal pain, a mechanism likely mediated by the anatole dependent relaxation of intestinal smooth muscle. Therefore, a combination of fennel curcumin essential oil has been used by a group and has shown to improve symptoms of the overall quality of life in patients with IBS. Some other herbs used for the treatment of IBS are Mentha piperita, named enteric coated peppermint oil, which plays an important role in controlling abdominal pain caused by IBS, aloe vera, curcuma, Fumaria officinalis, and hypericum, hypericum perforatum showed different mechanisms such as prosecretory activity, anti-inflammatory activity, and inducing gastrointestinal motility in the management of IBS symptoms. To conclude, the most common therapeutic approach for IBS includes education and reassurance, lifestyle, especially nutrition-based interventions, peripherally acting medications, which typically target motility, and centrally acting medications, which target visceral hypersensitivity and pain, and psychological interventions, which aim to reduce the effects of stress or symptom-specific anxiety. History taking in IBS patients is important for ruling out the role of certain foods and other dietary components in the generation of symptoms. That's everything from us. Thank you.